Mr. President,
The Senator for Montana.
I'd ask the quorum call be eviscerated.
The Senate is not in a quorum call.
I'll be darned. All right, well, good. So thank you, Mr. President. Decision earlier this week to undo the Affordable Care Act, a decision made by a bunch of unelected bureaucrats at the Department of Justice, is nothing short of a slap in the face to our democracy. The Affordable Care Act was passed by majorities in the House and the Senate, was upheld by the Supreme Court, and it continues to be supported by folks on both sides of the aisle. But nonetheless, the Department of Justice, through the direction of the President of the United States, has decided to undo the ACA and all the things that are in the ACA. This isn't the first time. For the last nearly a decade, I have heard a seemingly endless number of speeches on the floor of this body, and we've seen vote after vote after vote after vote under both Republican and Democratic leadership to repeal the ACA. Hasn't succeeded. So what the Department of Justice decided to do is take the law into their own hands and circumvent the legislative process. I guess they felt they had no other choice. Didn't just happen this week. Last summer, they refused to defend the provision of the ACA that protects people with pre-existing conditions. That's pretty interesting. My best friend in life, other than my wife, has diabetes. And he is somebody that has fought diabetes since we were in junior high. Folks didn't have diabetes, but he did. Still does. Was not able to have health insurance that was affordable until the ACA came along. He wasn't even allowed to change jobs for fear that when he did get health insurance, when he changed jobs, he would lose it and then have to go uninsured until the ACA came along. So when the DOJ decided to not defend the provision for pre-existing conditions, it left many of us scratching our heads. And then earlier this week, the administration took it even further by lending its full-throated support for overturning the ACA in its entirety, which would result in ripping health care away from tens of millions of Americans. This administration's actions would put millions of Americans at risk by getting every last protection that was enshrined into law, including Medicaid expansion and coverage for pre-existing conditions that are, without debate, providing life-saving and affordable health care to folks across this country. If they, the administration, succeed in dismantling our health care system, I guarantee you the cost of health care will rise through the roof. Oh yeah, no, they'll point to junk plans. There's junk plans out there, they're cheap, but they're called junk for a reason. Just hope if you've got a junk plan, you never get sick, because they're junk. But dismantling this health care system not only will cause health care to go through the roof, because we're going to go back to the old system. There is no replace here. We replace it with the old system. And it will imperil the sustainability of our hospitals across this country, but particularly in rural and frontier communities. And don't ask me about this. Go ask the hospital administrators. They will tell you that if the health care bill is repealed, they will either have to change their entire way they provide health care or close entirely. And once again, it will mean that American families are just one devastating diagnosis away from bankruptcy, particularly if you live in rural America. So this administration's heartless decision is going to have devastating consequences on Montana's families. Let me give you some statistics. From a Montana perspective, 50,000 Montanans who buy their health care coverage are on the ACA market. They would lose that. Now, 50,000 people, that's not very many people, right? In a state of 1 million, just over 1 million, that's a lot of people. 90,000 Montanans who received coverage as a result of Medicaid expansion would lose their coverage. I have told the story many times about a gentleman in Butte, Montana, that was fighting diabetes and, by his own admission, mental health problems. And when the legislature expanded Medicaid 2 years ago, he was able to get health care to get his diabetes under control. This guy was about 45 years old, by the way. Finally, be able to get his diabetes under control. And he was able to go see a psychologist to be able to get the tools that he needed to take care of his own mental health. And it resulted in his ability, for the first time in his life, he said, to be able to get a full-time job and to be able to support his family. He was incredibly proud of that. That's one story of many across Montana and across this country, where Medicaid expansion has done an incredible job getting people back into the economy and helping build our economy. But no, once the ACA is repealed, Medicaid expansion's gone. In Montana, we have 152,000 Montanans with pre-existing conditions that before the ACA would disqualify them for coverage for health care. If the ACA is repealed, they could once again face lifetime caps. So when you get sick and you need that health insurance the most, it won't be there because you'll be up against a cap. In the area of Medicare, where more than 110,000 Montana seniors rely on Medicare prescription drug plan for coverage of prescription drugs, well, that's going to be gone. It would reopen the donut hole, make hundreds of thousands responsible for these increased costs. And I can tell you, in Montana, where poverty is the highest is in Indian country, and they would lose their assistance to purchase coverage for cost-sharing reductions to eliminate out-of-pocket expense. These are our Native Americans. Or those who were able to get on expanded Medicaid would lose that. Now, these aren't nameless, faceless folks. These are folks like Donna from Big Timber, who after battling cancer wouldn't be able to access quality, affordable health care without the ACA. There are people like Jeffrey from Great Falls, who has a daughter with special needs, owns a business. He told me that his family and his business would both fall apart without the ACA. And it means the many folks in Libby who rely on quality insurance to access their community health center to address the unique health challenges that their government promised to protect would be gone. Look, I have said in this body, and I've heard speech after speech after speech about the ACA, what it does good and what it does not so good. But I'm telling you, if you want to cause a train wreck in health care, this is a great way to do it. Repeal it. Let everybody be on their own. And it's not going to be pretty. You start losing rural hospitals in rural America, and they will not come back. You'll see further depopulation in rural America because, by the way, that golden hour is called golden for a reason when you get hurt. And if that hospital isn't there, you're more likely to go live in a more urban population center where health care is more accessible. Nobody in this body has ever said that the ACA was perfect. But I firmly believe it was a lot better than what we had. And we always have the opportunity to step forth and improve it. Repealing it is not improving it. What repealing is a campaign promise. We've heard them before. We're going to repeal the Affordable Care Act, Obamacare. We're going to build a wall on the southern border. No matter if it separates farmers from their land, no matter if it creates a different border on the southern border, it was a campaign promise, just like repealing the ACA was. The reason we are in single digits popularity in this body is that we don't listen to the people. We listen to a select few who have certain people's ears in this body, and we don't make decisions based on what's best for this country and the people that live here. This is just another example of that. It is time the members of the greatest deliberative body wake up, take the ACA and improve the things that are wrong with it, and do our level best to make sure people can afford to get sick. Pretty basic. I yield the floor.